Welcome to this week's Whiteboard Wednesday. Today I'm going to be talking about injuries. And in this episode I'm going to just be covering some basics about injuries and injury prevention. In the next episode I'm going to get into some more specific treatments for minor issues, tweaks, tendonitis, things like that. I can't speak to more serious traumatic injuries. That's far outside of my scope of practice, and that's not something I have experience with. But treating minor aches and pains, things like tendonitis, overuse issues, that is something I have a fair amount of experience with and something that I can give some insight into, but that's going to be next episode. So the first thing I want to mention today is what I consider an injury. When I'm just using the term injury in the general sense, what I'm talking about is something that is going to last for more than a week or so. And other people may have different definitions. Some may only consider it an actual acute trauma, so a breakage, a torn Achilles tendon, ruptured ACL, whatever the case, maybe things like that. But when I use the term injury, I usually mean it as a somewhat more general sense of anything that's going to have a severe impact on ability to train for a while. It's going to seriously affect a person's training. And so tendonitis can be extremely debilitating. The worst issue that I've ever had, I've torn an AC joint, and that actually wasn't the worst problem that I've ever had. That interfered with training significantly less than some really terrible medial epicondylitis, golfer's elbow, that I had that lasted well over a year. So things like that, things like tendonitis can be just as or more debilitating in some instances than an actual acute trauma of some sort. So, and the reason I usually cut it off at a week and say a week or more is because personally I've yet to see any issue that persists for 7 days and no longer than that. Typically, an issue is either going to be a problem for 2 to 5 days, or it's going to be weeks, months, potentially longer. So you usually don't see any issue that's going to last for about 7 days. So minor tweaks, back tweaks, neck tweaks, some minor irritation, a lot of those things will resolve themselves within a few days. But if something persists for a week, it's probably going to persist for quite a bit longer. So that's just my general definition of injuries when I talk about injuries throughout this episode and the next episode as well. And the reason I decided to talk about this topic is because for the past couple of weeks I've been nursing a bit of an adductor issue in my left leg. And so I wanted to get a little bit into that and hopefully help people avoid similar issues. And thankfully I've never injured anyone else, but it's something I do to myself with a fair bit of frequency. And that comes in large part from the fact that I don't have a coach, and I am able to be significantly more objective with other people and their goals than I am with myself, which is a great reason to have a coach, so you don't do anything stupid, so that you have someone else who can actually view where you're at right now and your goals and view those things objectively and not inject their own emotions into that. So yeah, it would help to have a coach. But I like experimenting on different methodologies and things on myself. A little too much for me to have a coach at this point in time. And doing stupid things to myself helps me not do stupid things to other people. But when we're talking about injury prevention, one of the first things we want to think about is realistic goal setting. So not everyone is going to make it to the Olympics. Not everyone is going to be a professional athlete of any sort. And so it's important for people to, yes, you want to have goals, and hopefully those are at least somewhat ambitious, and hopefully people are confident in their ability to achieve those goals. But it's one thing to have an ambitious goal, and it's another thing entirely to have a completely unrealistic goal. And a lot of people oftentimes get caught up in unrealistic goals, or they're pushed to have unrealistic goals by their coaches, and they end up pushing themselves too far and farther than they should be going based on their actual own physical ability. Because if you don't stand a chance at getting into the NFL, but you're training like you want to, chances are you're probably going to get hurt at some point. So realistic goal setting is a must. And again, having a good objective coach there to help you out with that is always a good thing, and to keep you and your ego in check. The next step is assessment. And so in order to get a person on the right path and avoid injury, you have to assess where they are right at that particular moment in time. Because if you don't know where they are right now, all you have to go on are their goals. And so if they're starting here, if their ability level is here, but you don't know that, you might throw them into a program that's more appropriate for someone at this level of development. And that's going to be too much for them. That's going to potentially cause some injuries. So assessment is key. It needs to be thorough and comprehensive, and really give a complete picture of where that person is right at that moment in time. And also, it has to be that moment in time. So the testing, that is what should be considered fact, not, oh, I benched, X amount 2 years ago. It has to be where that person is right at that moment. And from there, you can design a proper progression from where they are at that moment to their goals. Again, realistic goals. And so that proper progression, there are different progressions for everything, but it just has to take into account the fact that you don't want to progress them inappropriately. You don't want to progress them too quickly. You don't want to start them in the wrong place. And just as an example of that, before someone moves into compound pulling movements, bent arm pulling movements, pull-ups, or even weighted pull-ups, it's important to develop their scapular strength first, for a number of reasons. One being that's going to help prevent shoulder injuries just in general, but also it's going to help prevent overuse issues as well, because it's going to ensure proper form. Because if you don't have enough scapular strength, they rely too much upon the arms and turns into almost a hanging bicep curl. It puts too much strain on the elbows and the shoulders, and so that can lead to overuse injuries. So it's necessary that you adhere to proper progressions whenever you're developing someone physically. And the last thing is appropriate testing. And so testing, just like training, it needs to be appropriate and it needs to be ramped up. You don't want to have a completely inappropriate test for someone that they're not prepared for. You need to prepare someone for a test. And obviously there are certain endeavors where people aren't going to be able to replicate the exact situation that they're going to be competing in and the stress of that, and that's fine. If we're talking the CrossFit Games or a military selection school, you don't want to necessarily simulate that exactly. You're not going to, in someone's training, have them go 5 days with only 4 hours of sleep just because they're going to do that in BUD/S when in training to be a Navy SEAL. Because that's not necessarily the best way to train. And that's more of one of those situations where they're just going to have to grind through that while they're there. You want to prepare them physically for it and mentally as much as you can without, again, opening them up for injury, without beating them down, because then they can actually lose confidence if you beat them down too much in training, and it actually does the opposite of what people think that is supposed to do. They think really tough testing prior to the main test will prepare them mentally, but sometimes it can just break them down. It can be too much for them, and it can make them lose confidence. So you want to make sure that it's appropriate. And you want to make sure that it's something that they're prepared for. Again, if it's the CrossFit Games and it's a bunch of random events, there's only so much you can do to prepare for those. But in general, you don't want to throw something really strenuous at someone in, say, a modality that they've never performed before. And one of the reasons I probably have some irritation in my adductor is because I was doing tons and tons of hiking, far more than I'm used to when I was on a trip out west. And so that combined with some other stuff that I was doing, single leg work, and it's a little too much. And so, again, you have to be careful with those sorts of things, and it helps to have a coach who can view your training and testing objectively and design that for you rather than designing it for yourself, like I design my own training. So yeah, that's really all I have to say about this stuff today. And again, next time I'll get into some actual treatment options. I'll deal with whether or not you should take non-steroidal anti-inflammatory drugs. That's a little bit of a controversial topic. I'll get into some things like electrical muscle stimulation, movement, compression, things like that can help with, again, minor injuries, not major injuries. If you have a major injury, go see a doctor. Even minor injuries, you should get a doctor's opinion before trying out any of the things that I'll be suggesting in the next episode. But those are going to be some things that you can try out, and that we have using some tools that we have access to here at Comprehensive Strength. And I'll get into that next time. So we'll see you next week.